Can we do rapid fire chiropractor question? I'm going to ask you a question. I want to hear, if possible, a one-word answer. This is Dr. Leon, my favorite body detective, and in my opinion, the best chiropractor on the planet.
Hi.
Number one reason people come to see a chiropractor.
Pain.
Number one biggest mistake people make with their body when they're feeling well.
Overdoing it.
Ooh. Biggest misconception people have about chiropractors.
That we hurt you.
That's true. Although sometimes I do cry like a baby in this office. I'm also very melodramatic. Number one best thing people can do for their back so they don't have back problems.
Ooh, that's a good one. Using good posture while sitting.
I have the worst posture. The barefoot training trend, beneficial or BS?
Very beneficial, but with the right progression. Know where you have to start.
True or false? Doctors make the worst patients.
Sometimes.
Present company excluded. In the setting of an injury, ice or heat?
Depends, but usually ice is number one for the first few days. Or if it's a spasm, you want to use heat.
What percentage of your practice is over the age of 56 and 2 months?
I wonder who that could be. I would say a good 30%.
Name one thing that people should not go to a chiropractor for.
Surgery.
Good answer. Chiropractor question. Flip-flops, bad or good for your musculoskeletal function of your lower body?
Depends on you and how well your body works. If you plan to run a marathon in flip-flops, not the best. But if you plan on walking to the store around the corner, that's fine.
Another question for you. The things that people can buy, like on Amazon for musculoskeletal pain, like a back brace, are these things advisable in your professional medical opinion?
Back braces, chairs, supports are only as good as a segue for improving yourself. Best thing is to get yourself stronger and have good guidance. All that stuff is if you use it as a crutch or as a segue is wonderful. But if you try to use it to support you at all times, you can actually atrophy and make those muscles a lot weaker.
What proportion of people with back pain do you think have a problem elsewhere in the body and not their back, and it's just being referred to their back?
I would say it's 50-50. So if you have usually a problem in the back, more likely you've already developed compensations in other parts. For example, the hip can cause a lot of problems that will mimic back pain. Or you can have a tight ankle or a foot, and then your glute doesn't engage, and that could cause lower back problems. So it's not always like a lower back is an issue, unless you're an offensive lineman in football and you're constantly getting pushed backwards.
All right, you are the man.